when should women start screening and how often?
So again, that depends on whether you're in the average or high-risk category. And as I said earlier, most women fall in the average risk category. And for them, all expert groups recommend screening either yearly or every 2 years starting age 50. Now, we don't have a consensus regarding screening average risk women between the ages of 40 to 49, and the reason it is still a matter of debate is that in this age group, we tend to see more false positive results on screening imaging studies. That means there's a higher chance of seeing abnormal things on the test, but upon further investigation with additional studies or even a biopsy, it turns out that it is not cancer. That said, in this part of the world, we tend to see breast cancer at a younger age. So if we look at the average age of Middle Eastern women coming in with breast cancer, it's almost 10 years younger compared to the women in the US or Europe. And because of that, I advise average risk women I see in my clinic here to start screening at age 40. So this discussion was for average risk women. What about high risk women? So for these women, we start at a much younger age. But it's not as straightforward as it is for average risk women in the sense that there's no one age for all approach. So the age at which we start screening can be different from one high-risk patient to the other. If we take the example of a woman who carries a deleterious mutation in either BRCA1 or BRCA2 gene, for that woman, screening starts as young as age 25. And again, as I mentioned earlier, screening consists of both a mammogram and breast MRI done every year. So the every 2-year option is not for high-risk women. If we take another example, a woman who is at high risk because she has, let's say, 5 relatives in her family who develop breast cancer. But after testing, it turns out there's no genetic mutation. Well, in this case, we recommend screening 10 years before the age of the youngest relative at the time she was diagnosed with the disease. So again, using the example of that woman, say her mom was the youngest family member diagnosed with breast cancer at age 46, then for that woman, we would typically recommend starting screening at age 36.